Differentiated thyroid cancer historically has been treated by mostly surgery and radioactive iodine, and it was usually cured, and in most cases still is cured by those two modalities. However, there's about 10 to 15% of patients in whom, even after surgery and radioactive iodine, the tumor may recur. And in those cases, if radioactive iodine is no longer taken up by the tumor or the tumor is growing anyway, other options were needed. Starting in about 2012, we had the first access to the kinase inhibitor sorafenib, and shortly after that, in 2014, the kinase inhibitor lenvatinib was approved. Both of these are multi-kinase inhibitors, and both of these provided patients with significant progression-free survival for the first time, giving patients for the first time a systemic option for treating patients, for treating their cancers. The phase 3 SELECT trial was a randomized placebo-controlled trial comparing lenvatinib to placebo in patients with differentiated thyroid cancer that was no longer responsive to radioactive iodine, and also were not candidates for surgery, for curative surgery. This trial was the watershed trial for getting the approval of lenvatinib, both in the United States and in the European Union, as well as other places globally. The patient selection was any patient who was radioactive iodine refractory, but they also have to have progressing disease within the prior 13 months or so. When we looked at the comparator between placebo or the patients who got lenvatinib, the randomization was 2-to-1. The patients who received lenvatinib were significantly more likely to have a longer progression-free survival than the patients on the placebo arm. The placebo arm patients had approximately a progression-free survival of about 3.8 months, whereas the patients who were on lenvatinib had a progression-free survival of 18 months. And so this is quite significant as far as patient care goes, and was the basis for the approval of lenvatinib at that time. In addition, we also saw very, very significant overall response rate of 63% and an overall survival that was not actually reached in the original trial. However, subsequent data that we found looking at analysis later on was that in the subgroup of patients who were over 65, patients who were over 65 who had received lenvatinib were statistically significantly living longer than patients who had been assigned to the placebo group. So this is one of the first times that overall survival was seen to be extended in patients with differentiated thyroid cancer on any kinase inhibitor therapy.